For this slide, we have my protocols and procedures. With my protocols and procedures, I had subjects that were recruited from the D1 UCLA Recreational Club sports. These athletes were required to have had sustained a concussion during their club season or sustained some type of hit or traumatic force during the school year while participating in their club sport that could cause concussion-like symptoms. This data has been collected from the start of 2017 to year 2023. As data has been collected, we are analyzing it and seeing if there is any significance within what has been collected by this head athletic trainer. The inclusion criteria are as follows. The athlete must have been attending UCLA as a student and participated in a club sport team. They must have sustained a concussion that had been diagnosed from the UCLA club head certified athletic trainer. The athlete must have gone to report concussion-like symptoms from a hit in their sport. Then they must have gone through the injury report in SCAT 5. Lastly, once they were asymptomatic, after a period of time, they needed to start a return-to-play program or an attempt of starting a return-to-play program based on zeros on their SCAT symptom evaluation sheet. The exclusion criteria was that they were attending UCLA without participating in a club sport team or they went through an injury report for another injury that is not related to concussion-like symptoms. So I decided to combine my data storage and my data collection. Since this was previously recorded data, the data collection was simply going to the head athletic trainer for UCLA Club Sports and asking for all the files of data that he has kept since he first started working at this site. He then handed over a huge box filled with injury reports and SCAT 5s stapled together for every single athlete, and all these files were from 2017 to 2023. They were unorganized and kept in folders. I then organized every single file in order from each year and put them into chronological order based on the dates of injuries that were listed on the paperwork. Each year was put into chronological order and placed into the manila folder after it has been organized. The variables were stored on an Excel sheet that only my head chair and I have access to view and make edits on. The hard copy files are now kept in a locked file box for safekeeping, and it is handy for whenever it is needed again. For the data collection, once I received the data was then reduced to the points I used in my Excel sheet that I wanted to focus on, which was listed in the previous slide. I felt that, and I decided that these were the most important parts of the data that I wanted to focus on to find significance, and it would show me the most data on the tie between concussions and return to play. So I wanted to make sure that my variables lined up with the main idea of concussions and return to play for these athletes. For my methods of data collection, for this, once I received the data from the UCLA head athletic trainer, the data was then reduced to points that I used on my Excel sheet that I wanted to focus on. There was a total of 16 variables that I ended up dividing and organizing on this Excel sheet, and the different variables are as followed. It wanted to focus on the athlete's sport, the athlete's gender, the athlete's age, the month and year that the concussion occurred, if baseline testing was completed before the concussion, and it's a yes or no answer, if they have a history of concussion, which is a yes or no answer, and how many, which is a numeric answer, their symptom score sheet number, which is their total number of symptoms on the SCAT 5 out of 22, their total symptom score, which is out of the entire added up all the symptom numbers, the best testing score, which is out of 30 errors, the return to play completed and the return to play steps completed. That is a yes or no answer for both of those. The return to play days from date of injury to full return to play, which is the amount of days total, and the return to play days from step 1 to step 6, which is also a numeric number, counting how many days it took them from completing step 1 to step 6. The main experience that each athlete went through for their concussion is an injury report and notes that were taken, and either a hit was involved and or concussion-like symptoms reported in result of something that occurred during the club sport activity. The athlete was then taken through a SCAT 5 where they were asked athlete background with history of concussions, symptom evaluation rated among a 0 to 6 pain scale, orientation, immediate memory with the list of words, digits backwards, months in reverse order, neurological screen, balance examination that is scored on error, and delayed recall from the list of words from immediate memory. As previously stated, all of these steps in the SCAT 5 have a type of scoring numeric to it, whether it be a yes or no question, rating symptom pain 0 to 6, or errors marked from the balance. Each of these numbers had significance in the deciding factor if the patient is surely concussed or not. If a concussion is suspected, they were required to come into the athletic training room every day and do symptom scoring. Until they reported that they were at all zeros for their symptoms, they cannot start the return to play process. Once they had been asymptomatic, meaning no symptoms were reported, for 24 hours, that counted as their day 1/step 1 of their 6-day/step to full return to play. They were also required to complete a symptom scoring sheet before and after each step's activities. This sheet was the same one as the one in the beginning of the SCAT 5 where they report which symptoms they are feeling in that present moment and report on a 0 to 6 pain scale. If there were any symptoms reported after that step completed, then the athlete stays on that step's activity until there were not any symptoms reported after. No regression or progression occurs until the athlete was asymptomatic after the activity. For example, if the athlete reported 0 symptoms before starting step 1 of light aerobic activity, then after they had reported 2 out of the 22 symptoms, then they are required to stay at step 1 until they can finish the activity with no symptoms after. As previously stated, once they had been asymptomatic for 24 hours, that counts as their step 1. Step 2 was light aerobic exercise, which usually is a result of 20-minute bike ride. Step 3 was sport-specific exercise, which was usually a type of bodyweight conditioning for 30 minutes. Step 4 was sport-specific, non-contact training drills and resistant training, which means they participated in the easier parts of their regular practices with no contact involved. 4B was impact retesting, where they only came in after they completed 4A. Step 5 was full contact training, or just a regular practice. And Step 6 was full return to play, meaning there was a full clearance for game participation. Each step was monitored by the head athletic trainer and dated upon completion with notes of what exercise they completed. Also, after Step 4 was completed, then the athlete will redo their impact testing and cannot continue on to the next step in the return to play process until the scores of that impact testing are showing similarities to their healthy baseline testing. Once Step 6 was completed, then the full return to play was completed and the athlete signed the paperwork to confirm. Next are the operational definitions of key variables within my research. So the 4 variables that I decided to focus on is return to play, concussions, SCAT 5, and baseline testing. Return to play is the act of beginning a process of getting a diagnosed concussed athlete back to activity by having them go through a 6-step process to get themselves prepared to return back into the sport as if all were well and no concussion symptoms arose any longer. This is overviewed by the athletic trainer to monitor the athlete during this 6-step process and making sure that they progress through each step properly. Concussion. Concussion is a type of traumatic brain injury caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. This sudden movement can cause the brain to bounce around or twist in the skull, creating chemical changes in the brain and sometimes stretching and damaging brain cells. SCAT-5. SCAT stands for Sports Concussion Assessment Tool 5. It's a concussion evaluation tool used for 13 years and older. It includes a SAC test and much more, a neck evaluation and balance assessment, yes/no symptoms checklist, and other information on injury and conditions associated with concussion. The SCAT-5 takes about 15 to 20 minutes to complete. Baseline testing. Baseline testing is a pre-season exam conducted by a trained healthcare professional. Baseline tests are used to assess an athlete's balance and brain function, including learning and memory skills, ability to pay attention or concentrate, and how quickly he or she thinks she can solve problems, as well as for the presence of any concussion symptoms. Results from baseline tests or pre-injury tests can be used and compared to a similar exam conducted by a healthcare professional during the season if an athlete has a suspected concussion. Baseline testing for this research involves impact testing before the season started for these athletes. Anticipated statistics. A total of 16 variables that were pulled from the data sheets and organized on the Excel sheet. The variables were as followed: return to play with the yes or no completion, return to play from step 1 to step 6 completion, return to play on how many days it took in total to complete the return to play steps, symptom score, symptom total, best error score, history of concussion, number of concussions from history, baseline testing, the sport played, gender of concussed athlete, age of concussed athlete, calendar year concussion took place, and calendar month concussion took place. These are the anticipated statistics that will be involved in the overall outlook and organization of the statistics used for the actual calculations. My plan for the calculation is to use SPSS, which will be used to calculate the numbers of yes, no answers given from the data of the variables that I will be focusing on. The plan was to have 3 different t-test variables to compare from the data in the data sheet. One t-test is comparing the concussion history to the full return to play from date of injury to return to play. The second t-test being if the baseline testing was completed for these athletes compared to the return to play steps completion. And finally, the symptom total to the return to play steps. All of these numeric or ordinal data will be inserted to SPSS to calculate the significance.